Mr. Speaker, if there's time for questions, I assume you still maintain that the fees on employers do not require a two-thirds vote in the legislature. Is that correct?
That's correct. The fees on employers are minimal requirements under law, minimal requirements that give the employer the option to pay a minimal guarantee of the health insurance of their workers or pay into the pool. In our view, and our lawyers, and certainly even Ledge Council, has a simple majority vote requirement.
Even if that were, if that is true, even if it were true, how do you get past a recess? When this would seem to fly in the face of not only the Maryland court decision recently this year, but the case in the 9th District Court of Appeal regarding the Hawaiian plan some years ago, forcing Hawaii to then get a specific waiver from Congress for a play or pay system. How do you get past a recess?
Well, we think that those two court proceedings are not consistent with the substance of our bill.
Why?
They're very different. As you know very well, you're a smart guy, Dan. The Maryland case doesn't deal with. I'm sorry?
Flattery that you know where.
Yeah, just that.
Yeah, the Maryland case, come on, they dealt with one specific issue. This is a comprehensive proposal that has many different aspects to it. It doesn't just have an employer participation in it. It has an employee participation in it. It has a government participation. It has fundamental reforms to the way health care is delivered to those that need it. It reforms the insurance industry, not just with underwriting reforms, but with real reforms. I mean, so this is a very, very different approach. Nothing that could be compared both to Maryland and even the Hawaii case. So we feel very confident that in the face of ERISA, we're going to be very consistent with federal law, and I don't see that as a threat. The bigger threat, I mean, to be very honest with you, is there's a referendum on this, and we're being very careful to not make this bill a Christmas tree to throw everything that everybody wants into it. And this is the danger of having a bill like this, because now that obviously there's an effort where we're working in concert, there might be some who think, okay, this is really going to happen now, which we believe it will. So obviously we want to make sure that in the process we're consistent with the law, not just state and federal, but we're also thinking about minimizing the potential for a referendum.
Mr. Speaker, on that subject, though, and one of the things that you've taken out of your bill, and the Pro Tem could talk about why he didn't have it in his, is the exemption for small businesses. And I would think if you're worried about the political calculation, the business community could come back and say this is no good, including the governor, who is very business friendly. Why did it come out?
Well, Senator Perata never had it in his. He can speak about that, but I'll tell you what.
Could you say it in the microphone too, sir? I'm sorry.
Well,
no, either one of them. No, just into the microphone. That was my point. Sorry, I'm sitting over here screwing it all up.
Yeah, it really is. We don't work well. We had everybody all in for ours because even though we have heard the plight of many small businesses, and I'm sure that most people, if they could, would, but the program simply does not work as effectively as we wanted it to, and it puts burden and strain on other parts of it if you take it out. And so the numbers were all calculated based upon all in. But that's going to be an issue that will be negotiated, I'm sure. Same way with individual mandate. I mean, that's not there, but it's not dead. I mean, we're still trying to look at some of the cost pools. I've said lots of times, and if this were easy, it would have been done long before this. So every time you do something, and recently people are really paying attention to this, because now, as the Speaker said, they think it's a real deal and maybe something's going to happen. And now that there is a single vehicle, then I think people will be paying even more attention to it.
Yeah, and this is significant. I mean, just with respect to the question about employees, and I exempted those that had $100,000 incomes or employees, 2 employees or less. And to be honest with you, so far, I've only gotten criticism for it. No one has come to the table and said, we really like that provision. We didn't see a lot of small businesses running to support us. In fact, people say, well, wait a minute, we don't like this. And so there didn't seem to be a whole lot of support for that provision. I think in that respect, Senator Perata was a lot smarter than I was when he developed this bill. But then again, he has more gray hair than I do, and I think maybe...
I've used the healthcare system a lot more than
Either or both you can respond. Some healthcare advocates are voicing concern about whether this plan would hold up to legal muster. And as a result, they're saying one revenue stream is being missed is tobacco. And they're proposing that we double the state tobacco tax, because we're now, I guess, 26th in the nation, and the legislature's never passed out, according to what they say, a tobacco increase. Is that workable to do?
You know, from my point of view, it's continuing this idea that we can make fundamental changes in major public policy with bake sales out in front of the house. You have with the cigarette tax a declining, and you're betting against yourself. You're hoping people, start smoking and then die, and then other people start smoking in order to be able to have a revenue stream. I just think it's, we want to get away from that. If this is as important as we all believe it is, it ought to have a stable floor of funding. Could we raise cigarette taxes or tobacco taxes and do some other things that we've been? Sure, we've done, 99's done it, we could do that again. But to look at that as even a small element into a funding base, I think destabilizes everything that you're doing. So that's my view.